This is your Diamond Insight for tonight of Cholera'S persistence due to systemic public health failures. Zambia has on average experienced an outbreak of cholera every 1.5 years since 1977, with the charity Water Aid labeling the latest one as the worst since 2017. Despite the government pledging in 2019 to eliminate the disease by 2025, the country is experiencing at least its 30th outbreak in the last 46 years or so. In this year's outbreak, more than 15,000 cases have been reported, with close to 600 deaths logged since October last year. Let's face it, cholera is a disease of dirt and hygienic conditions mainly caused by people consuming food and water contaminated with fecal matter. And that's why we must be ashamed that in the 21st century, we can be losing hundreds of valuable lives to such a disease which is even spread because of the dirt places where people trade from. For the most part, many trading and residential areas in Lusaka rate very poorly on the hygiene and cleanliness scale. Rubbish dumps a few meters shy of the entrance of a house, the kitchen or other areas where cooking takes place. Indiscriminate disposal of solid waste from vehicles in the homes and commercial premises, and to crown it, pit latrines and wells only a few meters apart. This is how the majority of our people live. Cleanliness is rarely ever top of the agenda. And whenever a government official moves to stop certain activities that promote poor hygiene and sanitation, including street vending, brewing and selling of illicit homemade alcohol within residential areas, that person is labeled a villain who doesn't care about how people will earn an income. We cannot think of any government effort to clean up this country that has been sustained as everything falls flat after a few attempts. What must it take for Zambians to up their cleanliness game? It is said that every situation has a silver lining. Could the silver lining in this punishing episode of cholera the country is currently experiencing be an irreversible change of attitudes to matters of hygiene and sanitation among Zambians? Will the 600 lives of loved ones we have needlessly lost finally tug at our heart and mind strings to mind the conditions in which we live? As citizens and individuals, we cannot share the responsibility of keeping our homes and other surroundings clean. No doubt the government has its responsibilities, but it must not take a government official to properly throw our garbage, buy us chlorine for our water to keep flies from our food. Garbage disposal services are available, but many people will not pay even when they can afford it, preferring instead to throw away their rubbish wherever they choose or to burn it, practices that are inherently unhealthy and which violate environmental laws and regulations. We can and should make better choices as citizens to prevent not only cholera but many other health problems and ease pressure on the public health system.